Hey y'all, my name's Shanna and I'm a nursing instructor, and today I'm going to talk about what nursing instructors notice about you immediately. As instructors, we are constantly assessing, not judging, assessing you as a student. So I wanted to tell you guys a few things that I notice pretty quickly. The first thing is your appearance and your mood. I can tell if you're dressed appropriately. Now, I'm not talking about you have to be like in professional attire, but it needs to be appropriate, right? Like, we're not going to the club or we're not going to, somewhere not appropriate. So I can always tell that, and I can tell like if you want to be there, That leads me to my second point, enthusiasm. I can tell if you're excited about learning to be a nurse. Some of the early content in your first semester of nursing school can be pretty boring, but I expect you to even just try to look enthused, like you want to learn everything you can about nursing, because it shows me that you're enthusiastic about nursing and entering the profession. My third thing is if you're prepared or not, okay? I can tell those students that walk in on the first day and they don't have their assignment done, or they didn't do the reading, or they don't have a pen, or they don't have a computer, or they don't have anything that they need, which doesn't look great on our end, because as a nurse, you should always be prepared for pretty much anything the world can throw at you. So I expect you to kind of be prepared for class, and I can tell immediately if you're not. Next is going to be your anxiety versus confidence. So I can tell those students who are extremely anxious. And I want to preface that by saying it's okay to be anxious, especially in the first semester. I'm used to anxious students. I teach first semester, so I'm used to that. But what I want you to do if you are anxious is to talk to somebody, right? I want communication. Talk to your instructor if you're feeling extremely overwhelmed or anxious. And then I can tell if we're super confident, but there's a difference between confidence and cocky. Everybody knows that. So we pick up on that pretty quickly as instructors. And then my last thing is your interaction with others. So I can tell if you're sitting by yourself all the time and not wanting to communicate or work with others. Now, the first couple of days, obviously you don't know anybody sometimes, so you're going to be a little more standoffish. But when we're in labs and we're collaborating in groups, I expect you to participate and kind of be more enthusiastic about participating, because as a nurse, you have got to learn how to work together. I would not have survived in the ER working as a nurse without my team, because we all work together and communicated. So we like to learn that and teach that in nursing school. So when you're in groups and you're working with people, be open and nice and communicate effectively when you're in those groups. But that's just a few things from our end as instructors that we look at as you guys.